Today we are presenting a program on behalf of American Muslim Women Physician Association. Our presenter today is going to be Dr. Sawsan Rashdan. She is a lung cancer oncologist at UT Southwestern Medical Center. American Muslim Women Physician Association has been in practice since 1999, was formally formed in 2008. It is a 501c4 association, and the purpose is to educate community and provide a platform for Muslim women physicians. And we're going to start our presentation with a surah class. So Bismillahir Rahmanir Rahim. Qul huwallahu ahad, Allahu samad, lam yalid, walam yulad, walam yakun lahu kufuwan ahad. And I will let Dr. Rashdan start her program with this prayer.
Thank you so much, Sanober, for this introduction. I am honored to be here today speaking about smoking and its risk, focusing on lung cancer. My name is Sawsan Rashdan. I'm one of the medical oncologists at UT Southwestern Medical Center. I specialize in lung cancer. So that's what I'm going to be talking about today. So first of all, I'd like to give a background about lung cancer. So lung cancer is a serious disease that affects many people and their families. Lung cancer is the leading cause of cancer death in the United States. Cigarette smoking causes most of lung cancer cases. So what is lung cancer? Lung cancer develops when the cells in the lung grow abnormally and form a tumor, as you see in the picture of how lung cancer looks actually after an autopsy. This lung cancer can be seen on a chest X-ray. This is a chest X-ray. You see this kind of whitish thing over here. That's how the tumor looks. This is the heart, this is the lungs, and that's how the tumor looks. So that's a simple chest X-ray. Lung cancer can also appear on CT scan, which gives a better picture. And this is an example of a CT scan showing the tumor here as kind of the white spot. Lung cancer is far more common in people who have smoked tobacco products. And you'll hear me saying this in this lecture over and over and over again, because smoking is the #1 cause of lung cancer. However, lung cancer can also happen in people who never smoked. Now, lung cancer mainly occurs in older people. So most people diagnosed with lung cancer are at least 65 years of age or older. A very small number of people are diagnosed at a younger age. As you see in this diagram here, that the vast majority of cases are people who are older than 60 years of age, so 29 between 60 and 69, about 34% between 70 and 79 years of age, and more than 80%, about 20%. However, only 16% less than 60 years of age. This is also another diagram that shows this fact. And although there are some cases, every now and then we see patients who are in their 30s and 40s diagnosed with lung cancer, the vast majority of the cases are actually above the age of 65 or 60. Lung cancer is the second most common cancer in both males and females. So it comes right after prostate cancer for males, right after breast cancer in females. And in 2022, there are about 236,000 new cases of lung cancer, about 117 for men and 118,000 in women. So although it is the second most common cancer, it is actually the #1 cause of cancer death. And it beats prostate cancer and breast cancer when it comes to death caused by cancer. So about 130,000 deaths happen from lung cancer every year. Lung cancer is by far the leading cause of cancer death, making up almost 25% of all cancer deaths. And it beats all colon, breast, and prostate cancer deaths combined. So what are the symptoms of lung cancer? How do I know if I have lung cancer? unfortunately, in the vast majority of cases, there are no symptoms at all. And that's the unfortunate part about lung cancer, because most cases actually diagnose patients at later stages. However, there are some patients who have some symptoms at earlier stages. If you didn't have any symptoms, it may be bronchitis type of symptoms, like a bad cold that's not getting any better, cough that gets worse or doesn't go away. Sometimes patients may have trouble breathing or shortness of breath. Coughing of blood can definitely be a worrisome sign, and if that ever happens to you, you should see a doctor right away. Weight loss for no reason. And we're not talking about a couple of pounds over the last couple of weeks. When we talk about concerning weight loss, we talk about more than 10% of weight loss that's non-intentional. Sometimes swelling of the face and the arms can happen also in rare situations. So lung cancer screening saves lives. And because lung cancer is most likely to be reported when it's detected in an early stage, because it really causes no symptoms, we really need to find a way to try to find out about lung cancer at earlier stages. This is exactly why lung cancer screening is very important in people who are at high risk. And sometimes, a lot of patients who I see who actually found out about lung cancer at early stage have had CT scan or chest X-ray for other reasons, like they're getting ready to do maybe a knee replacement surgery, and they get a CT scan of the chest, and that's when they find a lesion that requires a biopsy, and they find out about the lung cancer. But unfortunately, if you're going to wait for symptoms, a lot of times these symptoms happen in patients who actually have advanced stage. So lung cancer is not only one type, but there are several types for lung cancer. It can be divided into two main groups: non-small cell lung cancer and small cell lung cancer. As far as non-small cell lung cancer is the most common type, it also by itself can be divided into different subtypes, like squamous cell carcinoma, adenocarcinoma, or large cell carcinoma. The names reflect the different types of cancer cells that are seen in the lung cancer under the microscope. Small cell lung cancer, however, is a different entity. It's still recognized as lung cancer, but it's a completely different disease. It grows more quickly and spreads earlier to other parts of the body. It's really important to understand that these different subtypes of lung cancer are often treated differently. So it's really important when patients diagnosed with lung cancer to know exactly what type of lung cancer it is. And it actually gets more sophisticated now because we have really more personalized medicine and more personalized care for cancer. A lot of times we actually need to find more information, and even within the subtype, it's also subcategorized into different other smaller subtypes based on the genetic profile. And each of those are treated differently. So each case of lung cancer is completely, can be a unique case and different from other cases. So the most common type of lung cancer is the non-small cell lung cancer. It's 85 to 90% of cases of lung cancer, whereas small cell lung cancer is only 10 to 15% of cases. For non-small cell lung cancer, it usually arises in the outer region of the lung. It may look like pneumonia on chest X-ray. For small cell lung cancer, it's more aggressive. It grows rapidly, and it's strongly related to cigarette smoking. However, I want to say that cigarette smoking is strongly related to all types of lung cancer. However, if you're a never smoker and you develop lung cancer, that's probably going to be non-small cell lung cancer and not a small cell lung cancer. What about stages? So there are definitely a lot of other kind of different stages. However, I want to kind of just talk, give a kind of broad idea about the staging for lung cancer. It's a lot more complicated than this, but as a broad idea, we have stage 1, 2, 3, and 4. And for stage 1, it's simply, if you look here on the left, It's lung cancer. If you look here at the purple dot, it's only lung cancer that's in one area of the lung that has not gone to the lymph nodes. However, stage 2 is lung cancer that has gone to the lymph nodes in around the lungs. Stage 3, it's more spread into the lymph nodes, and it can be in different parts of the lung. And stage 4 is a lung cancer that has actually gone to other organs like the liver or the bones or the brain. And generally speaking, stage 1, 2, and 3 are curable, meaning that our goal is to get rid of the cancer completely. However, stage 4, once it travels to the bones or the liver, that's generally incurable. And the goal turns into controlling the cancer rather than curing the cancer or getting rid of the cancer completely. So how is lung cancer treated? There are several treatment options for lung cancer, and the treatment options are actually pretty complex, and it's getting more and more complex every year because it's about personalized medicine, and it's almost like each case has its own genetic signature, and we treat based on that. So it's really becoming very complex. However, there are many effective treatments for lung cancer right now. In general, the options are refined based on the type and the stage of the lung cancer. So it's important to understand what type of lung cancer this is. Is it non-small cell? Is it small cell? What stage that lung cancer is? Again, specific subtype, specific genetic signature of the lung cancer plays a very important role. How is the patient doing as far as other medical issues? Does the patient have COPD or other medical problems? That all can affect the treatment plan. Many of the treatments can be used in combination, either at the same time or after one another. And this is actually a real patient images here at the top of the picture. From the far left, this is when the patient was diagnosed with lung cancer in November 2013. You see here, this is just a quick explanation about how the CT scan looks. In the middle here, we see the heart. This is basically a cross section. So you'd imagine that the patient is laying on the bed. And this is a cross section in the chest area. And this is the back, and this is the front. And you're looking here at the heart. These are the lungs. Normal lungs should look like this, kind of black with white streaks. However, you see here this huge white thing over here, and that's how his lung cancer looked. Also here some infiltrates, as well, some lymph nodes. And in July 2014, this is right after treatment with chemotherapy and radiation. You see here still some scarring, but the whole picture is improved significantly. And here in March of 2022, the patient is basically cured of the cancer, all the scarring is gone, and the patient's basically just considered a cure of the lung cancer. So, So I want to kind of talk briefly about when each one of the treatments that we use for lung cancer. So surgery is one of the treatment modalities that we use for lung cancer. It's typically offered for patients who have early stage disease, when there is a high chance of removing all of the cancer out. The cancer and some of the normal lung tissue and lymph nodes are typically removed when the surgery is done. This approach will reduce the risk of the cancer coming back in the future, which we call recurrence. Sometimes after surgery, other treatments are recommended as well, depending on the spread to the regional lymph nodes, depending on how the cancer looks under the microscope, depending on the size of the actual tumor. We may suggest, depending on the quality of the surgery, was the surgery able to remove all the cancer or not? And based on that, we recommend some further treatments. It can be more chemotherapy, it can be more radiation after surgery. Radiation is also one of the modalities that we use for lung cancer. There's so many different types of radiation. It's basically high energy X-ray to damage the cancer cells and cause the tumor to shrink. And it's often used in combination with chemotherapy. Sometimes it's used in combination with chemotherapy, and a lot of times actually used on its own without any chemotherapy. There's a special type of highly focused radiation called stereotactic body radiotherapy, SBRT, and that can be offered instead of surgery in some patients in the earlier stages. What about systemic treatment? We used to talk about this paragraph as actually titled chemotherapy, but now it's actually titled systemic treatment. And the reason for that is that it's really not only chemotherapy that we give right now, but there's some other systemic treatments that we give. Immunotherapy is now playing a really important role in lung cancer. Targeted therapy is also plays a very important role in lung cancer. So the treatment, really, honestly, every year there's so much advances in lung cancer that we just have. Even our lectures are changing rapidly, and that's all for the good for the patients. So we use chemotherapy, which is a drug that kills fast-growing cells, including the cancer cells. It's commonly used in many different treatment plans, and even within lung cancer, based on the subtype of lung cancer, the type of the chemotherapy can be different. The side effects can be different. So if you know someone who has breast cancer, they receive chemotherapy, they probably receive a different regimen than a patient who received the chemotherapy for their lung cancer. A patient who has leukemia, for example, it's probably completely different chemotherapy. If you know a patient who has stage 3 lung cancer, it can be a completely different regimen than a patient who has stage 4. So really, it comes down to the specific subtype that we're treating, and that determines the treatment plan. The type of the chemotherapy can be different. The side effects can be different. So I have a lot of patients who say, I've heard bad things about chemotherapy. I really don't want to get it, but they probably have heard about other types of chemotherapy. Generally, chemotherapy for lung cancer, it does have some side effects, but it's well tolerated generally. Immunotherapy can also be given for lung cancer. Now we use it in pretty much all stages, early stage as well as advanced stage. Basically, the concept of the immunotherapy is to boost your own immune system to kill the cancer cell. And that's a pretty fascinating mechanism of action. There are some patients who are having some amazing results with immunotherapy. I've had few patients who have metastatic lung cancer who have actually sat down with them 5 years ago, or maybe more, and told them they're probably not going to be alive beyond 2 years, and they're actually now alive and they're off treatment, back to normal life from having metastatic cancer. So it's pretty amazing what immunotherapy can do, and we definitely use it across all the board in stages of lung cancer. Targeted therapy can also be used. And that all depends on the genetic signature of the tumor. So there are certain patients, but specifically in patients who never smoke, they have a higher chance for having a specific mutation that will allow them to get a specific targeted therapy. For example, I'm just going to kind of throw out that name. Tagrisso is one of the really fascinating medications that it's a pill that patients can take every day, and that works directly into specific mutation. In lung cancer and kills the cancer cells and has some amazing results. But again, it's only for patients who have that specific mutation signature. So lung cancer cases and deaths. So there's definitely a decrease in the incidence in lung cancer, and there's also a decrease in the mortality of lung cancer. So patients are there's less deaths of lung cancer. And there are several reasons for that. Number one reason is that people are actually quitting smoking. Back in the 90s, everyone used to smoke. Now, a lot less patients are actually smoking, and that's helping with the smoking, with the lung cancer incidence and lung cancer deaths. There are a lot of advances in early detection. So lung cancer screening has actually helped in reducing lung cancer deaths by catching lung cancer at an earlier stages where we actually can get rid of the cancer completely, rather than waiting for the symptoms to kick in when the patient is actually at a very advanced stage. There are also some advances in treatment. I already told you that, when we used to talk only about chemotherapy, now we talk about really cool drugs like immunotherapy and targeted therapy that has less side effects and actually work better for some patients. So people truly are quitting smoking. If you look at this graph from the 1900s when people started smoking, I think it's in the the 1960s, maybe 80. In the 1990s, people started to know about smoking risks, and the smoking prevalence just dropped down significantly. And this is a very cool figure here. It just shows you that this is the blue line is the actual line, and it's the cancer deaths that has happened over the years. You know, here 1985, 1990, 2000, 2015, 19. This is the actual what has happened. But this red line would show you that this is what would have happened if people didn't quit smoking. This is how much deaths we would have seen from lung cancer if people didn't quit smoking here. And that's pretty frightening. You know, here's the same as for women. So if people didn't know about the smoking risks, we would have had a lot more cancer deaths than we have right now. We still have a significant amount of cancer deaths, but that's much better than what would have happened. Unfortunately, the area, what we call the MENA or the Middle East and North Africa region, have very high prevalence of smoking. Basically, this graph just shows the projected prevalence of tobacco products consumption for patients who are aged more than 15 years of age. And it just shows you here that, for example, in Lebanon, it's the highest smoking prevalence among females across all this area. And it's projected that in 2025, 50% of the males in Lebanon will be smoking, whether it's, you know, cigarettes or hookah or any tobacco products. For females, by the year 2025, 37.7% would be smoking. And that's a very high percentage. And that's really scary because, you know, we haven't seen that before. And, you know, with all the risks of smoking, that's really pretty scary. Again, we do see now less advanced cancer and more early stage. With the lung cancer screening, we have seen a decrease in the cases that are diagnosed as a distant disease, as you know, or distant disease or cancer that has spread to other organs from the lungs, or stage 4 cancer, and a little bit of increase in the cancer that's local. So more with the cancer screening, because it helps us identify early stage cancer, we're seeing more stage 1 and 2 cancers and less stage 4 cancers. And that's pretty amazing, because that's pretty good, because we do have better treatments for earlier stages than for stage 4. Again, as we said before, that our goal with stage 4 is to control the cancer, but our goal with the earlier stage is actually to get rid of the cancer completely. So we have better chances of getting rid of the cancer completely. This is just another graph that just shows the prevalence of smoking, and that's from 2019. And definitely we see some areas that have a very high prevalence of smoking around the world. So how can smoking cause lung cancer? So when you smoke cigarettes release about 5,000 different chemicals. And these harmful chemicals enter the lungs and can affect the entire body. The chemicals, what these chemicals do is that they damage the DNA, including parts that protect against cancer. And what happens is that it becomes harder for the cell to repair the DNA damage, and the cell gets crazy and just starts growing rapidly. And that's how cancer happens. So what are the risk factors for lung cancer? Smoking causes lung cancer as the number 1, 2, 3, 4, 5, 6, and 7 reasons for lung cancer is smoking. I can't emphasize of that, you know, anymore. It's really important to know that smoking causes cancer. There are some other risk factors for lung cancer, but they're much less common than smoking. Exposure to radiation can cause lung cancer. Other chronic lung diseases like lung fibrosis can cause cancer, but rarely ever see that. The vast majority of the cases that I see in the clinic are caused by smoking. So tobacco smoking causes about 80 to 85% of lung cancer cases in the United States. The smoker risk of developing lung cancer is about 10 to 30 times greater than that of a non-smoker. Cigarette smoking is the most common cause of lung cancer, again and again. All forms of tobacco use cause lung cancer. So that includes pipes, cigars, chewing tobacco. All of that can cause cancers, whether it's of the mouth or the throat or the lung. So cigarettes, cigars, hookah, and pipe smoking all can cause cancer. Studies have shown that actually smoking the light cigarettes or the low tar or low nicotine cigarettes does not lower the risk of lung cancer. So there's no light smoking or light cigarettes. Studies also show that the risk of lung cancer from smoking cigarettes increases with the number of cigarettes smoked per day. And people who smoke have about 20 times the risk of lung cancer compared to those who do not smoke. So it doesn't matter how much I smoke. I get that question a lot. If you smoke less, you have less risk of lung cancer. If you smoke more, you have higher risk of lung cancer. And that is true for the years of smoking and also for how much you smoke. So for example, a person who smokes 1 pack a day for 30 years, that's 30 pack years, they have this much exposure of smoking. Compared to a person who smokes 2 packs a day for 15 years, they have the same exact risk of lung cancer compared to that person who smoked 1 pack for 30 years. So it does matter how long, and it does matter how much you smoke. Is it too late to quit smoking? It's really never too late to quit smoking, because smokers who quit more than 15 years or for more than 15 years have an 80 to 90% reduction in their risk of lung cancer compared with people who continue to smoke. After a person has quit smoking for 10 years, the risk of lung cancer decreases from 30 to 60%. So quitting smoking can also reduce the risk of lung cancer regardless of how many years a person has smoked. So this is a graph that just showed you that the risk of lung cancer mortality, patients who never smoked have very low risk of having lung cancer. Patients who stopped smoking at the age 30 have a little higher risk. Patients who stopped smoking at the age of 50 have a slightly also more higher risk, but patients who continue to smoke have the highest risk of death from lung cancer. Are there any other risk factors for lung cancer? Yes, there are. Dust and fumes can cause lung cancer. Other lung diseases, very advanced fibrosis of the lung can cause lung cancer. Some family history of genetic risk can cause lung cancer. However, it's extremely rare to see a true lung cancer that runs in the family. It's mostly the whole family that smokes. That's why they have lung cancer in the family. But for patients who never smoked, there are some cases that just run in the family, but they're just extremely rare. Exposure to radiation can also cause lung cancer. Arsenic, asbestos, occupational environment exposure, and just radiation, previous radiation history. So for patients, there are some patients who've had previous radiation, for example, for their breast cancer, and that's they do definitely have a higher risk for having lung cancer in the future. But that happens typically many, many years after the breast cancer radiation. Other tobacco products are all harmful and addictive. Yes, all of them are harmful and addictive, and that includes smokeless tobacco, cigars, pipes, hookahs or water pipes, bidis or kretiks. All of them have a lot of carcinogens that we're inhaling into the lungs, and all of them cause lung cancer. And in fact, not only lung cancer, but other types of cancer. For example, chewing tobacco is highly linked to head and throat cancer. So what are light cigarettes? I get this question also, that there are some patients who actually smoke light cigarettes. Do they cause less risk of lung cancer? The answer is no. In fact, they're actually linked to more risk of lung cancer. So the tobacco manufacturers redesigned the cigarettes since 1950s and called them light. However, what they did is that they did put more filters to trap tar. They have more porous cigarette paper to allow toxic chemicals to escape. They do have ventilation holes, and they do have different blends of tobacco. The truth of the matter is that lights, actually, this is a study that was done in 2017, and it actually shows that light filtered light cigarettes are actually not less hazardous than regular cigarettes. So they're not any safer than regular cigarettes. Again, there's actually a report that says because patients, when they smoke light cigarettes, they actually tend to smoke more. They have, there's actually a link for light cigarettes to be linked to more cases of lung cancer. There is something that's called Family Smoking Prevention and Tobacco Control Act. On June 22nd of 2019, President Barack Obama has signed into law that granted the FDA the authority to regulate tobacco products. And one of the provisions of the new law bans tobacco manufacturers for using the terms light or low or mild. And that was pretty awesome. However, these tobacco manufacturers still are using the same code color. So what used to be light, that's actually, gold packet. It's still a gold packet, just not the word light. So people actually still think that this is actually lighter. It's important to understand that this is actually these what so-called light tobacco products are actually, they definitely do not have any less cancer risk. In fact, they're actually linked to more lung cancer risk. So what do I do to prevent lung cancer after this lecture? Number one, don't smoke. If you already smoke, then quit. And the number two thing is to actually get screened. So what does that mean? How do I get lung cancer screening? This is where you go back to your primary care physician and ask about lung cancer screening and see if you're eligible. It's basically a program that's similar to the breast and bowel screening program, like when you go to get your mammograms for females or when you go to get your colonoscopy. This is a similar program. It's aimed to detect lung cancer cases at an earlier stage. It's typically done with a CT scan. It takes just multiple pictures of the lung to create a 3D image. It basically uses low doses of radiation, but shows a more detailed picture than the regular X-ray. Research has actually shown that doing these kind of scans regularly in patients who are identified as high risk for having lung cancer reduces the death from lung cancer. So how do I know if I qualify for lung cancer screening? Well, if you're 50 to 80 years of age and you are currently smoking or have quit in the past 15 years and have had at least 20-pack year of smoking history. So what does that mean? So 20-pack year, that can be either 1 pack per day for 20 years or half a pack a day for 40 years. Remember, the length of the smoking and also how many cigarettes a day matters. So if you do actually qualify, then you should be getting lung cancer screening protocol, which is with a low dose computed tomography. So low dose CT scan. So not the regular CT scan, but a low dose CT scan. And what does that mean? That means that this specific CT scan that you'll be getting has a lower dose of radiation, just enough to be able to see a good picture of the lungs, but not enough to cause lung cancer from radiation. So the benefits of the screening is that it does increase the chances of detecting lung cancer at an earlier stage, where it's easier to treat it and may be curable. It has shown that it decreases the risk of cancer death from lung cancer in people who are over the age of 50 and who have had a heavy history of smoking. This is the difference. I want to show you that, get that question a lot. can I get just a chest X-ray and not a CT scan necessarily to the lung to see if I have any lung cancer? Well, the answer is actually no. The chest X-ray does not detect lung cancer earlier. This is a patient who has an early stage lung cancer. If you look at the chest X-ray, it's completely normal. But if you actually look at the CT scan, you can definitely see a big mass here that was actually kind of hidden behind the rib here. So do qualify for lung cancer screening, then you should be getting the low dose CT scan. If you're concerned about the radiation dose that the CT scan gives, well, I can assure you that the low dose CT scan gives a very much less radiation dose than the regular CT scan that you do in the normal setting. So in air travel, you have a very slight amount of radiation. In the chest X-ray, you have a little more. The mammogram, you have a little more risk of radiation. The low dose CT scan, you do have this amount of radiation, but in the diagnostic CT scan, you do have much higher dose of radiation. So how can I get help to quit smoking? There are many groups that can actually help quitting. There's smokefree.gov. Go online, check that website. There's step-by-step quit guide. There's also NCI smoking quit line. And there's 1-800-QUIT now, and all these are very active. They have kind of step-by-step guide for you. So the conclusion is tobacco smoking causes about 9 out of 10 cases of lung cancer in men and about 8 out of 10 in women. A diagnosis of lung cancer is serious, but treatments have improved enormously in the recent years. In general, people with lung cancer do better if they are diagnosed early in an early stage disease. So recognizing lung cancer symptoms is very important. Lung cancer can often be present without symptoms, so lung cancer screening is also is very important tool to detect lung cancer early in people who are at higher risk. Thank you so much for attending.
Thank you. This was an excellent presentation, covered a lot of topics, such a vast topic that you covered in such a short amount of time. So thank you. We'll ask audience if they have any questions that they want to ask Dr. Rashdan. I did have a question myself. For vaping, or let's say for smoking, when there's no nicotine at all, because some of the patients claim that they have no tobacco in vaping products. How would you advise them? Would that still increase their risk of smoking cancer?
Well, it's not very, as far as the vaping, because it's such a new thing. I think the data are not mature. However, it's really not only the nicotine that causes the lung cancer. There's so many carcinogens that we inhale from that pipe that after the burn and all that process that happens, all that actually causes the lung cancer as well. So it's really not only the nicotine that's responsible for the lung cancer, it's all the other stuff too. So I would advise highly against vaping. And I think the data that we're going to have in the next few years are going to show that, how extremely dangerous that is. That's also apart from, the kind of the short-term lung diseases that you're actually more of an expert in that happens from vaping. But as far as lung cancer, I think we're going to have a lot of more data in the next few years. Because it's just because lung cancer takes many, many years from the time of the insult to the cells until the time of the cancer happens. But I think the data are going to show something that's scary from vaping.
Yeah, I absolutely agree with you. I tell them, except for fresh air, anything else that they use is going to harm them sooner or later. So
yes.
Yeah. Okay, well, I don't have any questions from the audience. Is there any other pearls of wisdom you would want to give?
I think honestly, just quit smoking. That's number
Absolutely.
one. Quit smoking, don't smoke, and get screened. Those are the kind of three words that everyone needs to remember, and kind of spread around, especially in our community. I think that's very much needed, because unfortunately, although smoking is decreasing, but the hookah and other tobacco products are definitely increasing, and that's very unfortunate.
And one question for patients that either don't have health insurance or have health insurance and have high deductibles, does the cost of low dose CT or the lung cancer screening go towards their screening? Because usually for screening, you don't pay anything. Let's say pap smear.
Yes, it's approved as a screening tool. It's considered just like mammography or colon cancer screening, so it should be covered. There are multiple programs, studies that they can also enroll in that looks at cancer screening that has no cost. So there's several tools. If there's ever any question or worry about the lung the CT screening cost, I would advise that at least that I know at UT Southwestern, if they call, we will actually guide them to something that's free of charge.
Oh, perfect. Excellent. Well, thank you for your time. And then I think we're going to end the program.
Awesome. Thank you
for your time and effort.
Thank you so much.
Bye.
Assalamu alaikum.